Although stereotypes linger, a trip to the oral and maxillofacial surgery office is no longer the stressful and painful experience older adults remember. Today's modern oral and maxillofacial surgeons provide patients with a very comfortable surgical environment and appropriate anesthetics to ease their discomfort and anxiety. Most oral and maxillofacial surgery takes place in the OMS office, utilizing minimal sedation, moderate sedation, deep IV sedation, or general anesthesia. The surgeon's intensive anesthesia training, lifelong learning through didactic and hands-on continuing education programs, and their self-regulated office anesthesia evaluations assure that patients receive the safest, most effective anesthesia care available.
Anesthesia was essential for the development of oral and maxillofacial surgery. If you think about it, dental extraction is by far the commonest surgical procedure carried out in the world, and probably in every individual country in the world. And to do it in a civilized manner requires anesthesia of some kind. Before we had anesthetics, surgery, first of all, it wasn't performed very often, and when it was kind of barbaric. Many of the early pioneers in our specialty were in fact pioneers in anesthesia in general, because in a way anesthesia developed by way of dentistry.
In the 1840s, dentists Horace Wells and William T.G. Morton discovered the anesthetic effects of nitrous oxide and ether.
The early pioneers in the specialty of oral and maxillofacial surgery were essentially looking for techniques that could be office-based. So people like Adrian Hubble, Harold Crowe, were specifically looking for these outpatient techniques in the 1930s, 1940s, 1950s, and they were instrumental in developing those techniques and making them safe and reliable techniques, and they have certainly been adopted by some of the other medical and dental specialties.
Today, the administration of anesthesia is an integral component of the training every oral and maxillofacial surgery resident receives.
The oral and maxillofacial surgeon is unique among non-anesthesiology practitioners throughout the healthcare setting, in that the oral and maxillofacial surgeon trains side by side with anesthesiologists, physician anesthesiologists, and under their direction.
Oral and maxillofacial surgeons are trained so they have the ability to maintain patient safety.
The training of the oral and maxillofacial surgery resident in anesthesiology includes both clinical and didactic exposure. In the classroom setting, residents are taught the basic principles of anesthesiology, as well as the pre-anesthetic assessment of these patients and management of complications. Clinically, residents are exposed to a wide variety of outpatient clinical experiences, both in the adult and pediatric patient.
We continue with didactic sessions that include classroom setting, ACLS recertification, SIM-MAN, emergency scenarios. So our training is not just on a clinical basis with a one-on-one patient interaction. It continues outside the clinic as well.
The oral and maxillofacial surgery training program provides education and training in anesthesiology beyond what is typically required in the office setting. This allows the surgeon to be prepared for any situation which they may encounter.
They then spend 2.5 years in training perfecting their outpatient ambulatory anesthesia techniques, until by the time they are fully trained, they have more training in outpatient ambulatory anesthesia than any other specialty.
The administration of anesthesia is an essential skill that oral and maxillofacial surgeons continue to perfect through a lifetime of continuing education, or CE. Oral and maxillofacial surgeons use a variety of anesthetic agents to ensure the comfort and safety of their surgical patients.
The oral and maxillofacial surgery team consists of the surgeon, along with the dental anesthesia assistant and the surgical assistant. The oral and maxillofacial surgeon is ultimately responsible for all aspects of the surgical and anesthesia delivery.
We help the doctor in administering the anesthesia. We monitor the patient before, during, and after the surgical procedure. We do go through training as the team, and Amos has provided some wonderful resources for the dental anesthesia assistant. I enjoy all aspects of oral and maxillofacial surgery, but I enjoy the intensive care that has to be given to a patient who's undergoing office anesthesia.
I had an excellent experience with the anesthesia. The team made me feel very comfortable. I had never undergone anesthesia before, but at the same time, they were very informative as to all the steps that I was going through. They made me feel very comfortable. It was essentially a painless procedure. After they had gotten me ready to go, I went to sleep, and next thing I knew, I woke up and the procedure was over.
The ASA and AOMS have a good working relationship in terms of preparation and patient safety. One of these areas is the Office Anesthesia Evaluation Manual. Those are parameters of care that the AOMS use for patient safety. ASA has reviewed all of these and have found these to be at the highest levels of patient safety. Many of these include ASA standards of care.
I think the office anesthesia evaluation is very beneficial. I view the inspection as a blueprint. I use the office anesthesia manual as a guide. It helps me equip my office with proper equipment and monitors, all my emergency medications, and I use the simulated emergencies, those scenarios, to train my staff on a regular basis.
The AAOMS Office Anesthesia Evaluation Program is a prime example of how professional organizations and government agencies can successfully work together to assure patient safety. The American Association of Oral and Maxillofacial Surgeons developed its Office Anesthesia Evaluation Program nearly 4 decades ago and made it a requirement for association membership. When state governments began establishing mandates for in-office anesthesia administration, they often based their guidelines and evaluation programs on the thorough process of the AAOMS model, or actually even adopted AAOMS's Office Anesthesia Evaluation Program. Consequently, when I conduct an anesthesia evaluation of a colleague's office, I do so not only as a representative of our association, but also as an agent of the state of New Jersey.
As we have seen, office-based anesthesia provides many significant benefits, such as comfort and safety. However, none of these is more important than improved access to care for patients. As we know, many patients in our country have little or no insurance coverage, which can put surgical care in a hospital or outpatient surgery center beyond their reach. With the efficiency, flexibility, and reduced cost of office-based anesthesia, these same patients are more able and more likely to have their surgery performed in a comfortable and safe office setting.
Office-based anesthesia, as practiced by oral and maxillofacial surgeons, is the safest anesthetic technique available today. With its short-acting agents, its rapid induction, its light level of anesthesia, its rapid recovery, and it has an unparalleled safety record in anesthesia, and I might add, an unparalleled patient acceptance. Patients like this technique.